You are welcome back to Arise Health TV. Breast cancer has been a very dangerous illness that has been a threat to women over a decade. Today we are going to be diving deep into it as we explain to you people all the important things you need to know about the illness. Breast cancer is one of the most common cancers that affects women, and people assigned female at birth. It happens when cancerous cells in your breast multiply and become tumors. About 80% of breast cancer cases are invasive, meaning a tumor may spread from your breast to other areas of your body. Breast cancer typically affects women age 50 and older, but it can also affect women and people AFAB who are younger than 50. People assigned male at birth may also develop breast cancer. What causes breast cancer? Experts know breast cancer happens when breast cells mutate and become cancerous cells that divide and multiply to create tumors. They aren't sure what triggers that change. However, research shows there are several risk factors that may increase your chances of developing breast cancer. These include age, being 55 or older, sex. Women and people AFAB are much more likely to develop the condition than men and people. Family history. If your parents, siblings, children, or other close relatives have breast cancer, you're at risk of developing the disease. Genetics. Up to 15% of people with breast cancer develop the disease because they have inherited genetic mutations. The most common genetic mutations involve the BRCA1 and BRCA2 genes. Smoking tobacco use has been linked to many different types of cancer, including breast cancer. Drinking beverages containing alcohol. Research shows that drinking beverages containing alcohol may increase breast cancer risk. Having obesity, radiation exposure. If you've had prior radiation therapy, especially to your head, neck, or chest, you're more likely to develop breast cancer. Hormone replacement therapy. People who use hormone replacement therapy, HRT, have a higher risk of being diagnosed with the condition. Symptoms of breast cancer. The condition can affect your breasts in different ways. Some breast cancer symptoms are very distinctive. Others may simply seem like areas of your breast that look very different from any other area. Breast cancer may not cause noticeable symptoms either, but when it does, symptoms may include a change in the size, shape, or contour of your breast, a mass or lump, which may feel as small as a pea, a lump or thickening in or near your breast or in your underarm that persists through your menstrual cycle, a change in the look or feel of your skin on your breast or nipple. Your skin may look dimpled, puckered, scaly, or inflamed. It may look red, purple, or darker than other parts of your breast. A marble-like hardened area under your skin. A bloodstain or clear fluid discharge from your nipple. How to diagnose breast cancer. Healthcare providers may do physical examinations or order mammograms to check for signs of breast cancer, but they do the following tests to diagnose the disease: breast ultrasound, breast magnetic resonance imaging, MRI scan, breast biopsy, immunohistochemistry test to check for hormone receptors, genetic tests to identify mutations that cause breast cancer, stages of breast cancer. Healthcare providers use cancer staging systems to plan treatment. Staging cancer also helps providers set a prognosis, or what you can expect after treatment. Breast cancer staging depends on factors like breast cancer type, tumor size and location, and whether cancer has spread to other areas of your body. Breast cancer stages are: Stage 0. The disease is non-invasive, meaning it hasn't spread from your breast ducts to other parts of your breast. Stage I. There are cancer cells in nearby breast tissue. Stage 2. The cancer cells have formed a tumor or tumors. The tumor is either smaller than 2 centimeters across and has spread to underarm lymph nodes, or larger than 5 centimeters across, but hasn't spread to underarm lymph nodes. Tumors at this stage can measure anywhere between 2 and 5 centimeters across and may or may not affect the nearby lymph nodes. Stage 3. There's breast cancer in nearby tissue and lymph nodes. Stage 3 is usually referred to as locally advanced breast cancer. Stage 4. Cancer has spread from your breast to areas like your bones, liver, lungs, or brain. How is breast cancer treated? Surgery is the primary breast cancer treatment, but healthcare providers may use other treatments. Breast cancer surgeries include mastectomy, lumpectomy, breast reconstruction. Providers may combine surgery with one or more of the following treatments: chemotherapy, radiation therapy, including intraoperative radiation therapy, IWRT, immunotherapy, hormone therapy, including selective estrogen receptor modulator, SERM therapy, targeted therapy. Types of breast cancer. Healthcare providers determine cancer types and subtypes so they can tailor treatment to be as effective as possible with the fewest possible side effects. Common types of breast cancer include invasive infiltrating, ductal carcinoma, IDC. This cancer starts in your milk ducts and spreads to nearby breast tissue. It's the most common type of breast cancer in the United States. Lobular breast cancer. This breast cancer starts in the milk-producing glands, lobules, in your breast and often spreads to nearby breast tissue. It's the second most common breast cancer in the United States. Ductal carcinoma in situ cysts like IDC. This breast cancer starts in your milk ducts. The difference is cyst doesn't spread beyond your milk ducts. Less common breast cancer types include triple-negative breast cancer, TNBC. This invasive cancer is aggressive and spreads more quickly than other breast cancers. Inflammatory breast cancer, IBC. This rare, fast-growing cancer looks like a rash on your breast. IBC is rare in the United States. Paget's disease of the breast. This rare cancer affects the skin of your nipple and may look like a rash. Less than 4% of all breast cancers are Paget's disease of the breast.